Technology loves us, right? All right, says we're live.
Let conversations happen at happy hour. Welcome to Ours.
Welcome aboard.
This is the PT Podcast. Here's your host, physical therapist, Jimmy McKay.
All right, must be live because the announcer lady said it. Welcome to the show. Thank you for telling a friend and sharing the show online. Now we are doing this via video. You can watch some of our interviews in video form. I've never seen it. My mom told me I had the face for radio at a young age. I don't really see the need for video, but we're doing it anyway. I can view it on YouTube, on Facebook, as well as a replay available for you on iTunes, Spotify, and Google. Want to say thank you for telling a friend about the show and sharing the episodes and what you find valuable about them. That's the only way people find out about them. Talking about value today, we bring in Pam and Naomi, part of PACER. We've done several episodes on this, so I'm going to give you guys. I'll do the official golf slow clap on PACER. I had Sharon and Angela on, who were just a few of the people really getting PACER moving. And for the audience who's been seeing the hashtag PACER project, we'll throw it on the screen here. It is wrong graphic. There we go. Post-acute COVID-19 rehabilitation and exercise project. That's what PACER stands for. And so the audience listening and watching knows that PACER content is free for APTA members and potential members. We always call them potential members, not non-members. Potential members at apta.org in the Learning Lab. Here with Pam and Naomi. Ladies, I say Pam, welcome back. Naomi, welcome to the show.
Thank you for having us.
Thank you.
Awesome. So you guys are part of PACER. You guys are coming together to do some content as we navigate this whole thing, as we navigate how this whole technology thing works, in a COVID world. What project do you guys get to dig your teeth into and share with the profession?
So the project we did is on pulmonary rehab. And so our background is we're both outpatient pulmonary rehab therapists, and I also do cardiac as well. And but we're not really at the point yet in the COVID cycle, I should say, that we're really looking at outpatient yet. So what we did is we kind of took our expertise, and we both have some acute care background as well. And Naomi's actually back working in the acute care right now temporarily too, that we kind of took that background and took it back to where do people need right now? And so we did a little bit on the, what they look like in the hospital, but it's really geared for post-acute. So it was geared more for home health, subacute, LTACs, nursing home kind of settings for people that might be seeing patients with COVID-19 and what are the pulmonary rehab, kind of implications and the interventions.
What are some things, Naomi, as we welcome you to the show, as you look frozen, but maybe you can still hear us, so I'll just ask the question anyway. This is how we roll with technology. What are the things, some of the highlights that you guys are going to cover in your part and your donation to PACER as you add some more content in there? What are some of the things that you think therapists need to know, and some of the things that maybe they don't know now that you definitely want them to pay attention to? All right, I'll take your silence as agreement, and we'll move the same question to Pam as we will work to get Naomi back. What are the things that, as you guys dug into this, Pam, with Naomi putting this project together, that are really important? Like if you were in an elevator with a fellow clinician, you said these are the 2 or 3 things you need to pay attention to as you work towards a post-COVID patient.
Yeah, so really the 2 biggest things that we're seeing are endurance and strength. That there's a major endurance issues, and that really stems from the pulmonary system. Even if they haven't been hospitalized or in an ICU setting, a lot of these patients have real severe decreases in endurance. And then from the strength standpoint, in our PACER project, we focused a little bit more on the respiratory muscles, but there's a lot of other musculature issues. And what we're finding is the core, trunk, and even some of the upper extremities more than the lower extremities may be involved, which is different than most people that have been in the ICU. And the weakness that they're having is much more severe than somebody in an ICU with a different type of illness.
Yeah. Naomi, as we bring you back, dealing with some technology issues there, but we got you reconnected, was just kind of asking, what are some of the things that you'd want clinicians to know, instead of just the topic, some of the subtopic, Pam really talking about some of the deconditioning, upper extremity, maybe even more than lower, and that's not typical. What are some of the other things that you'd want clinicians to know as you put together this content for the PACER project?
I'm not sure if Pam may have touched on this as my connection went out, but I think the picturing and understanding vital signs, because a lot of these patients are going to have vital signs that may not be your expected response to exercise, and you have to be prepared to know what vital sign responses mean and what you need to do in the moment to address any abnormalities.
Yeah, I think the cardiopulmonary section of the APTA is very, very excited whenever you get to use the hashtag vitals or vital, right? Paying attention to those things. I think that
For
really,
sure.
I think, Naomi, that really highlights really one of the fundamental reasons that the PACER project came together, which was you maybe you're not maybe in your regular role in your day to day, you're not used to working with a certain type of patient, but these patients are going to be making their way to you no matter what. So PACER and that project as a whole is a real great refresher on a lot of different things that you should have and are in your scope of practice that you should be paying attention to.
Mm-hmm.
Why did you guys decide to jump in on this? What about the project jumped out at you and said, hey, let's spend some time and effort and put together some content? We'll start with Pam.
I think, for me, it was when this all first started, everybody kind of didn't know what to do. We were all kind of up and, what do we do next? What's going on? And so, Angela Campbell and Sharon, as you said, were on the other day, or I think last week. They nicely kind of started gearing everybody up and saying, okay, acute care is really tackling some of this acute care stuff, and the cardiopulmon's working with them. Why don't we kind of spearhead us acute care, home health, geriatrics, orthopedics, anybody that wants to be involved, to get that education out to everybody that needs it? Because we were all getting email after email every day. What do I do? What do I do? These people that aren't used to treating patients with cardiovascular and pulmonary issues, now we're being asked to treat somebody in it, and it's a totally different virus than any of us have ever treated. And so for me, it was one of those, okay, how can I help? My outpatient area was closed down. I worked a little bit in the hospital to start with, but then since I'm per diem, they put me on furlough so that they could keep full timers there. And so it was what's my way to help? And so this kind of became one of those ways that I could help, was to, to kind of get all of this information together and then out to the people that need it.
Naomi, we'll come back to you. You have a little bit of an eclectic background, some outpatient and some acute care experience. Talk about that for just a second, and what you get to bring from your background to this part of the PACER project.
Yeah, so I think that I have a few different things to bring. One is that I'm a newer clinician myself, so I kind of I'm still learning a lot, and I think that gives me a good perspective on helping other newer clinicians, or even more experienced clinicians who are newer to this area of PT, to understand kind of where they may be coming from and the sorts of things that they may really want to know. But as somebody who's worked both in acute care and in outpatient fairly recently, and in both settings, I think that I have a good perspective of kind of, this is how these patients are likely to have received care while they're admitted to the hospital. And then these are the sorts of transitions we're looking at as they move out of the hospital setting into post-acute care, and what sorts of things the therapists should or could be looking at as the patient makes that transition, knowing from my own experience how things are in the acute care setting and how they are in the outpatient setting, which I think that a lot of the therapists who may end up seeing these patients may not have that acute care background, or may have a very limited acute care background.
Well, I'm glad you're able to bring some of that insight and share it. Have you guys been taking a look at any of the other content being produced for the PACER project? If so, what are some of the things that you think are really beneficial for the profession coming out of this resource?
Yeah, so what we did is, ahead of time, we reached out to the speakers that were going to be on other topics similar to ours, so that we all coordinated, so that we weren't doing the exact same thing. So
Yeah.
Mary Massery and Anna Mejia Downs doing pulmonary stuff. We reached out to some of the other people. I think Larry Cahalan and Steve Tepper were doing a couple of the ones. We reached out to Ellen Hilligas before hers, and just to kind of make sure we were all hitting the same sorts of points, but not the same thing.
Sure.
So I personally have gone through and listened to most of them, as well as some of the other products that have come out. There's a sort of a Saturday series webinars that have been going on since the beginning of this. I've listened to most of them as well, just because even in it, I find others' perspectives around the country, their backgrounds, their knowledge just helps everybody learn more.
I have actually not listened to that many of them. I have still been working a full-time clinical schedule throughout this, including going actually back into the hospital some, even though my primary area of practice is an outpatient now. So I've not listened to as many as I would like to have. But that being said, I think one of the best ones that I've listened to so far has been Ellen Hilligis's Vital Signs one, because she just goes into so much depth about interpreting the vital signs and what they mean and why different things are important and how you can utilize that in your practice. But yeah, I mean, there's just so much information out there, and I think one of the really great things about the PACER project and the other webinars that are coming out is just the collaboration with every section and everybody just working together so hard to get all this information out. And I feel like I haven't ever seen that in any other area of PT content before, where all the different sections are just collaborating on everything, and everybody's kind of like, what can I do to help? Give me something to do. And I feel like that's really inspiring to see everybody be so motivated and wanting to work together to get these webinars and this information out there.
Yeah, to your point, the APTA really just kind of planting a flag and saying this information is going to be free. We're not going to put it to just members. It'll be members and potential members. So pretty much anybody who needs to access this important information will be able to get it. What's something that you've learned still being in clinic, Naomi? Something that you've really picked up, from when Hilligas says something, people pay attention because she kind of says it like a drill sergeant, and that's what I love about her. Like, she sounds authoritative. Like when Ellen says something, you kind of sit up a little taller. I do anyway. What about that one have you taken and put into practice in your work in the hospital?
Honestly, it's a really simple thing in that in my clinical practice, I pay a lot of attention to vital signs, but I don't always look at the respiratory rate quite as much as the other vital signs. And her point about how important the respiratory rate may end up being in this patient population has meant that I've started to measure that a lot more, whereas before I looked more at the quality of breathing, but not necessarily the rate itself, because I work with pulmonary patients, or I should say patients who have a pulmonary diagnosis. And so I don't often see a normal breathing pattern and respiratory rate, but with these patients who prior to this infection more than likely did have a normal pattern, I think that in this instance, that respiratory rate can be a really valuable addition to your typical blood pressure, heart rate, and SpO2.
Yeah, well, you focused right there on something Ellen, loves to hammer home. I mean, you said it almost like sheepishly, like, well, it's a basic thing, but she focuses on the basics, right? What's more basic than the vital signs? And time and time again, we're saying we see that these things are very, very important. So good on you for focusing on the basics. I think we might have lost Pam just a little bit. So Naomi, you're on the hook for the parting shot for this episode. Are you ready for that?
I hope so.
Yeah.
This is the parting shot.
All right. Not sure if Pam, if you can still hear us, we'll come to you next for the parting shot. But we'll start with Naomi. Naomi, what's something you want to share with the audience to make sure they do not overlook working with patients post-COVID?
Don't overestimate the power of your vital signs, because they are going to tell you so much about how your patient is doing.
Hashtag vitals of vital. Pam, good luck. It's your turn for the parting shot. What's something you'd want people to remember as they look at your content in the PACER project as well as the rest of it?
So for our content, I think the thing we'd want everybody to really take away is that you're not doing anything you haven't done intervention wise, but you have to do it specific to that patient. Every single person is going to look really different with this virus. And so you have to just decide what point are they at? How much can you put push them and how much do you not want to push them. Then overall, I would say my parting shot is take advantage of all these free resources. That collaboration is huge. There are so many webinars and they're all being recorded, so it's not part of the project. That Learning Center at APTA has loads upon loads of COVID webinars for everybody to go to, and there are a variety of different topics.
Love that. Again, we have it on the screen here, but if you're listening, PACER content, again, free for members and potential members at apta.org in that learning lab. Naomi, Pam, thanks so much for putting this out there. Pulmonary rehab considerations and techniques for the COVID-19 positive patient. Appreciate you guys doing that for the profession, and thanks for so much for talking about it with us today.
Thanks for having us.
Yes, thank you.
This is the PT Pinecast.
Perfect. That's